think of the bank status. So I don't see why our circle cannot grow also to a level of a bank if we can increase the membership and also have the other basic requirements. So I feel strongly that this can really grow to a level that can meet needs of more people across, and obviously of course generate some income for the organization. We also need to strengthen the agriculture program. As I've said, currently we are only doing the vegetable growing only for AIDS clients, and that's only a small percentage. We want to involve all other community members. As much as the AIDS affected people want to improve their nutrition and income, so does the other members of the community. They also want to improve their nutrition and income. So we feel we have neglected the other members, because the seeds we give, the tools we give only go to the AIDS people, while the others are just looking. So we want now to consider incorporating all the rest of the community and supporting them, and we feel this will go a long way to change the economic and social life of this community, because essentially Uganda is an agricultural country, and we don't see why this community should be left behind when we are in a country known to be agriculture based. So we want to support as much as we can the food growing, and also consider the food security, which we have not actually addressed yet. And if our people can have enough food, taught how to keep it, taught how to sell and save, then I don't see how we should stay behind in poverty. I believe we can go a long way if we are empowered. So, yeah, the unique thing that KIDA is from others is that we address the whole person, the holistic approach. That's the mental, the spiritual, the physical, and the economic aspect. So you can't address the mental part of the person or only the economic part of the person when the person has a moral, degenerated life. He won't live happily too. You can't give him enough money and you think you have done it when he's sick. So we feel what we are doing is much different, because we are addressing the whole person. The other organizations, some of them say, for instance, deal on only human rights. They're only interested about rights, and maybe that's all. The other organizations are interested on only, say, maybe medical care. They only offer medical services. It's a hospital, it's a health unit, and they don't consider the economic aspect, for instance. The other organizations say consider water, provide water services to the community, and that's all they do. But we go beyond that. So we are an all-round organization that will cover the needs of the whole person. And this, I think, would be a learning tool for other organizations really to learn from us. Our drama group actually organizes plays that also are all-round. For instance, they could have a play that you would not only address the HIV/AIDS needs, but also the human rights. You find they are talking about, because the abuse of human rights can indirectly lead to the spread of HIV/AIDS. So our plays can come embracing all these aspects. It talks about HIV/AIDS prevention, it talks about the human rights, it talks about the economic aspect, how people can work hard and support themselves, reduce poverty, because we know poverty is one loophole that can increase AIDS. So that's how we really talk to people through plays that are all round. We also talk about bringing out hygiene and sanitation programs in our shows. So the drama is an important tool in addressing the holistic needs.
Called Akora George William. I'm an HIV/AIDS counselor working with the Virika Hospital AIDS Relief Project, and I work as an HIV/AIDS counselor. Particularly, I'm responsible for working with HIV positive adolescents. And one of the interventions of helping children living with HIV, apart from the medication we give them under our program called the palliative care, we also give them psychosocial support. Under psychosocial support, we give a lot of programs, and the first one is the counseling, where we counsel children one-to-one, depending on their age, to deal with their social issues. Another program is the life planning skills training. We try to give these adolescents, as you know, the challenges they get through growing up with HIV. They get a lot of problems and challenges. For example, self-esteem, worries about their life. As they advance in age, they develop more concerns about life. So we give them social skills, like the relationship skills. We deal with also their concerns about the reproductive health, issues of getting spouses if they are older adolescents. All those programs, we work with adolescents during the training programs. And as I have earlier said, they work with the Village Hospital, but Village Hospital networks or partners with the KIDA, Kitojo Integrated Development Association. It's one of our centers where we bring treatment and care for HIV positive people, not only children only.
We prescribe the drugs which are dispensed to the clients, and of course I have to find out all the infections that the patients are having, and then prescription is done after the dispensing goes on.
My humble desire and vision for this KIDA is to help the people to stand on themselves, get them empowered, support themselves. I would be so happy to find that a child who was just orphaned and had no support is now able to stand on himself, able to work on himself, and maybe get a job and support his siblings or his family. I would be happy to have that. I would be happy to find that this community is able to access the medical services just right there. And they are able to, out of having good health, good care, they are able to save. Because if you have a hospital within closed circles, you have to save on transport and the like, and you are able to do other programs. I want to thank the Friends of Rwenzori so much from the depth of my heart for the love and for the care and financial support that they have always extended to us. They have been brothers, they have been sisters, they have been parents. Actually, they have been part of this community, even though they live thousands of miles away from this place. May God bless you so much.
Asante sana.